Live from Eyewitness News, this is breaking news.
Good afternoon, everyone. I'm Danielle North. Governor Raimondo giving her latest briefing right now. Let's listen in live.
To my team, who continues with their heroic work in getting us through it a day at a time, I'd like to reiterate some messages from yesterday, roll out some new plans that we have, and then turn it over to Dr. Alexander Scott to give us the update. We do have 2 new cases to report, and I will have her go through all of that. First and foremost, I'd like to remind everybody, avoid crowds, avoid really crowds of any size. In the past week, we've gone from 250 to 25. Yesterday, the White House said 10. So take it as seriously as you can. Stay home if you are sick, absolutely, especially if you're a restaurant worker. Stay home. School kids, teenagers especially, who are home on break. I know we're all going to get cabin fever quickly enough. Stay home, go for a walk. It might be the only time in your lives that your parents tell you to play more video games and a little time on social media. But really, avoid the malls, avoid parties, avoid sleepovers. We got to keep everybody healthy, so please be serious about this social distancing. Especially for folks over 60, we need you to stay home. Senior centers continue to be closed, but by now most cities and towns have figured out ways to provide meals and basic elder care for folks in the community over 60. And I would direct you to your mayor or your town manager or town hall or your local senior center to find out what's going on in your specific community. Today, I'd like to make a few additional announcements as we continue to ready Rhode Island for the continuation of this crisis. I will say this. Rhode Islanders are being fantastic right now. By and large, people are heeding our directives, and the few of you who aren't, I'm going to ask you to get more serious about it. I see it every day. I see neighbors helping one another, small businesses helping one another, restaurants, as painful as it is for them, doing the right thing and closing down. Now is the moment for that to happen. Now's the time to let our spirit of Rhode Island, our kindness, our generosity, our patience, our view that we really all are in this together to come forward. I'm seeing it. I want to thank each and every one of you for that. Special thank you to those on the front lines, doctors, nurses, therapists, CNAs. But because people are being so kind and patient, it's making this a little bit easier, and I know will help us to get through it. To that end, I would like to give a very special thank you to the United Way and to the Rhode Island Foundation. Both of them have stepped up and as of today, opened a Rhode Island COVID Recovery Fund. I want to thank both the United Way and the Rhode Island Foundation for your leadership on this. They came forward, as so many Rhode Islanders are coming forward, to say, how can we help? They're opening a recovery fund. They started it today. They've already raised $1.5 million, and that's going to be money made available to nonprofits in the community to help our most vulnerable. I've been getting a lot of questions around what are we doing for the homeless, what are we doing for children in poverty, what are we doing for folks who need access to food and clothes and homes and transportation. And so this is a concrete step, $1.5 million already, and I want to say thank you to the United Way and the Rhode Island Foundation. I especially want to thank the companies who've already stepped up immediately to contribute that $1.5 million. It's Bank of America, National Grid, Hasbro, Blue Cross Blue Shield, and Amica. I'm asking everyone else, if you are an individual or a company in a position to give, please call the Rhode Island Foundation, call the United Way, and make a contribution. Now look, I know most people aren't in a position to give right now. Most people are just trying to get through it. And I understand that. But big companies, certain individuals are in a position to give. Now's the time to pitch in. So thank you for setting up the recovery fund. Thank you to those who've already contributed. And thank you to those who I know will step up. And I hope at tomorrow's press conference, I can read off another 5 or 10 names of good citizens who've stepped up here to help Rhode Islanders. For the social services agencies who may be in need of some of this assistance, those of you on the front lines, call the United Way, call the Rhode Island Foundation, and ask about their response fund. I want to say a special thank you to businesses, both small and large, for being so collaborative. We have another call today at 2 o'clock. We're trying to have regular, large conference calls with businesses to help them with the transition and keep everybody in communication with us. I want to particularly thank all of you who are allowing your employees to work from home and paying your employees. Every large business I've talked to and many medium-sized businesses are doing just that. They're letting people work from home and paying people to do that. Any business out there who hasn't moved to this allowance of allowing people to work from home, telecommuting, I'm asking you to please consider it. If you can do it, it's the best thing to do for your employees, for public health, and for our economy. And I know that isn't easy, especially small businesses and manufacturers, it's hard for you to do it, but it's the direction we want to go. To that end, I'm pleased to announce a few new measures that we have in order to help you to do that. Last week I reached out to Microsoft. I had a meeting with manufacturers, many small manufacturers, who said they'd like to allow people to work from home, but they didn't have the technology and they weren't sure how to do it. So we reached out to Microsoft, and I'm pleased to say that Microsoft has agreed to provide their Office 365 program for free for the next 6 months to all employers. That includes web-based Microsoft Office application, resources to support telecommuting, such as meetings and instant messaging, as well as remote file sharing. This extends to businesses of all sizes. And here in Rhode Island, it extends to all businesses. So nationally, Microsoft has said if you're already a customer, they'll provide these services for free. But I want to be clear, here in Rhode Island, Microsoft has extended a special benefit to Rhode Islanders. All businesses of all sizes can have access to the Office 365 for free for the next 6 months. And I'd ask you, members of the media, to get that word out, and we're going to be pushing that message through Rotary clubs, accountants, chambers of commerce, but obviously I'd like to thank Microsoft, and I would like to encourage all businesses to take advantage of that if that can be helpful. There are many other businesses. I know Google is offering some assistance. I think Cisco is offering some assistance, so obviously you can avail yourselves of those as well. The state's Department of Technology has been taking the lead on this. Their website is www.doit.ri.gov. doit.ri.gov. You can go to their website. They have a special section related to this Microsoft offer. You could also call 521-HELP. 521-HELP is a helpline that we have at the Commerce Department. If you have any questions in general, if you're a small business, around lines of credit, access to liquidity, how to deal with employment issues, 521-HELP is a good line to call. At yesterday's press conference, I announced that we have applied for a disaster declaration with the SBA. I'm pleased to announce this morning that the SBA has approved of our disaster declaration request, and there will now be loans available to all of Rhode Island's small businesses. up to $2 million for working capital, so you could continue to fund your operating expenses as we get through this. For small businesses interested in that program, I would direct you to the SBA, and I think Mark Hayward is here. He runs the local SBA office. He's terrific. You can call the SBA, go on the SBA's website. You could go on Commerce Rhode Island's website, or again, 521-HELP. It's probably the quickest thing. If you need a loan, if you want to know about the SBA program, if you want to know how to get access to telecommuting software to let folks work from home, 521-HELP. I know there's some anxiety out there among parents, teachers, principals related to schools. When will they open? How will we do distance learning? I am hoping to make an announcement around that tomorrow to provide further guidance. So if everyone, and I would like to do this as a state. You're seeing in some other states where different cities and towns are doing their own thing, and it's creating a lot of confusion. So I am asking mayors and superintendents to just give us another day, and by tomorrow we ought to be able to provide guidance to the entire state as it relates to K through 12 public education. Before I turn it over to Dr. Alexander Scott, I would like to offer a special message to our restaurants and bars who are really getting hit hard. There's no other way to say it. We are seeing a skyrocket in our unemployment insurance claims, and I know you were hoping today would be probably the biggest day of the year so far. So to those of us who are in a position to be able to do takeout or delivery, consider doing it to give some support to our local restaurant owners. And to those of you who are struggling, reach out if we can help you. And know also that every single day I am pushing as hard as I can with the president, with our federal delegation, who've been fabulous, to ask the federal government to step up as soon as possible with relief. More unemployment insurance, a stimulus package, more low or no interest loans for businesses. So just because I haven't announced it today doesn't mean we're not working on it. There'll be more to come every single day. At this point, Rhode Island is handling this as well, if not better, than any other state. It doesn't mean it's easy. It's still going to get worse before it gets better. And if we stay level-headed about it and follow the directions, we're going to get through it. We will absolutely get through it, and as safely as possible. So thank you, and I'll turn it over to Nicole.
Thank you, Governor. Good afternoon. I want to echo the governor's message about how hard she's working on everyone's behalf to really put Rhode Island in the forefront. I want to also extend gratitude to our colleagues, to Neil of the Rhode Island Foundation and Courtney of United Way. Your leadership and your support are tremendously important right now as we work through this together as a state. And we know that this is something that you do regardless. So we appreciate you. And want to give a huge kudos to Microsoft as well for stepping up, and we hope that other entities will follow. I want to give a special thank you as well to our healthcare provider community. These are our folks who are on the front lines out there now, that we're working extremely hard to get them personal protective equipment, to get them support in caring for patients. That is the community that we are all doing the steps that we're requiring you to do to be able to help that community who's out there. So a huge thank you to our healthcare providers. So a quick data update. Since we last spoke, as mentioned, Rhode Island has 2 new cases. One is a man in his 50s. He has a recent travel history to many different locations, including Germany and the United Kingdom. The second case is a woman in her 40s We are working to determine the origin of her illness. These individuals are both at home and they're both recovering. That brings our total number of positives to 23. We have had 403 negative tests, and close to 3,000 people are now self-quarantining. Those are our unsung heroes who are doing their part to help make sure the remaining population in Rhode Island is protected. So let's make sure to appreciate them as well. As always, we will continue to include these updated numbers in our press release today, and we'll post them online. So I want to start with our Rhode Island Department of Health State Health Laboratories. They are doing phenomenal work. We have the supplies, and with their work, we have the expanded human capacity at the Rideau State Health Laboratories to do the expedited testing that I spoke about yesterday. So this expedited testing is for patients who are hospitalized, patients who are living in nursing homes or other congregate settings, and for healthcare workers, including EMS. We're continuing to work with our congressional delegation and with the governor, are really calling out to our federal government to get the swabbing kits that are needed to fully support the testing for additional populations at other laboratories. As I said yesterday, testing is helpful for us overall as a state to understand the scope of the situation here. It's also helpful to know that at the individual level, particularly for those that have the mild to moderate illness who can recover at home, it's not going to impact the treatment recommendations that you receive to get testing. I want to make sure that everyone understands what the key is with this virus. The virus spreads illness from person to person in crowds and in those situations. So when someone is ill, whether it's COVID-19 or the flu or another viral infection, being able to stay home and recover safely there is critical to help minimize spread of this illness. To share a few additional brief updates, we're sending guidance today to oral health professionals. Our instruction is that dental offices should suspend non-essential, non-urgent dental care for the next 21 days, which is in line with the guidance from the American Dental Association that has been shared. We will continue to be engaged with our dentists and revisit this with them and other oral health professionals in the coming weeks. We've also received a lot of questions about funerals and wakes. So we want to offer some clarification here that stays in line with what the governor has been asking. Our guidance remains to avoid large events and crowds. That does apply to funerals, wakes, and memorial services. At most funerals and wakes, more than 25 people will be gathered. And we are asking particularly more vulnerable populations to not attend those services. For funerals that are taking place, attendance where it can should really be limited to select families. Older adults, people with underlying medical conditions, and people who are sick for sure should stay home. One option is to live stream services for people who are not in attendance, and we certainly encourage other creative ways to make sure that families receive the support that we know families need. This is a hard message to deliver. We are very aware of how important it is to gather with family and friends to grieve the loss of a loved one. But this guidance is about keeping the other people in your life, those other loved ones in your life, healthy and safe. When in doubt, just stay home and continue to use the remote services, telephone, video conferencing, and other ways that you can to support each other. Another update is about calling 911. We want to make this clear. If someone is experiencing a genuine medical emergency, a heart attack, someone collapses, absolutely call 911. However, if someone is not experiencing a genuine medical emergency, please do not call 911. We want to refrain from straining our healthcare system, which would mean that emergency medical services, EMS, that would respond would have to use a set of personal protective equipment such as respirators or masks when they are not necessary if they are called for situations that do not require a genuine medical emergency. We have the supply of personal protective equipment that we need for our healthcare workers right now, but we need to be thoughtful and need to be judicious about how we are going forward. Finally, I want to bring up the 2020 census. You've heard us talk about the census in the past, and it's here. I'm particularly mentioning it because our Rhode Island Foundation and United Way colleagues have been right here with us in helping to make sure that Rhode Island positions ourselves best regarding the census. People are starting to get their notices in the mail to go online and fill out the census. It only takes about 5 minutes to do so. Myself, the governor, Neil, Courtney, and others have been talking about the importance of the census for quite some time. Maybe for some people, it felt a little abstract and remote then, but now it's real. This is exactly why the census is so important for situations just like this. We are doing our public health planning and our modeling based on census data we have right now, and we need to make sure that everyone is counted. The funding that we're receiving, the laboratory supplies we're demanding, the response supplies that we receive are all determined using a formula based on census data. The more we know that everyone is counted, the better off we can be as a state in requiring the information and the equipment and the supplies that we need. This is why we need everyone to be counted. If you've not received your census mailer yet, you will be in the coming days or weeks. Please know that federal law prohibits the Census Bureau from sharing your personal information with anyone outside of the Census Bureau. It is so important that everyone is counted. Please make this a priority, particularly during this time. So I'm going to stop there and open it up for questions for the governor and myself.
Governor, why hold off for another day on guidance on K through 12?
Because we're still in the process of working with different school departments to figure out who's ready for distance learning. And we want to make sure that if that's the path we choose, that the cities and towns are going to be able to actually deliver a high-quality education in a distance learning fashion versus just closing school.
Governor, I know you mentioned the restaurant workers and possible help, and I know you're still discussing that. What are some of the options that are available if you can at all ease some of these people's fears? I know as you go forward, what are some of the options? I know I've heard mentioned cutting some of the taxes, whether it be for the restaurants or employees.
So the number one thing is unemployment insurance, and I would strongly encourage, we're going to do the right thing. You know, obviously we're going to pay every claim, we're going to pay it as quickly as we can, and we have largely made this mainly online now, so we ought to be able to avoid what happened in the last recession. Folks were hanging online for an hour and a half or 2 hours, so we're hoping we're in a better position now. Having said that, as I said, you know, our unemployment insurance fund is getting hit pretty hard right now, and that's the right thing is that Congress needs to pass another stimulus to replenish that fund. The hope is, because Rhode Island is being so aggressive right now, it will allow us, more than other states who haven't been so aggressive, to recover more quickly. So at the moment, you know, the right thing to do is to stay closed, to collect unemployment, file for one of these small business loans if necessary. We're going to crank up our philanthropy to really help folks who need it. And at some point, and I don't know when, so don't ask me, I don't know if it's 2 weeks or 2 months, we'll be able to open the spigot again and gradually restart our economy. And we're planning for that. But at the moment, I'm confident that the right thing to do is what we're doing.
Do you know how long the trust fund, the unemployment trust fund has at the current pace, which is
It depends. It depends. It depends. Like everything, these models depend on the assumptions. If 10,000 people a day hit it, we're talking, a month and a half to 2 months. If more people do that, then it's less.
Are all state workers going to begin to work remotely as well?
Those who can. So there are some state workers who are essential workers. We are at work today. There are others who provide, certainly everyone in the Department of Health is working. So HHS workers are working. So everyone who's not essential, who can work from home, we are doing better every single day to get them home. We are making it easier for state employees to use their paid time off, to claim their sick time. We're getting rid of a lot of bureaucracy that can stand in the way of that. And then we're also taking other measures that I would urge companies to do it if they haven't. We no longer have the cafeteria operating. So you can go in and buy your lunch, but you have to eat it at your desk. We've really shut down all lobbies, areas where people can congregate. If you have to be at work, we're trying to keep you isolated.
Governor, is a moratorium on rent, mortgages, utility payments, is that something that's even remotely on the table at this point?
That isn't something that any one state could afford to do on its own, or at least not for a sustained period of time. That is something that I think the Congress and White House and Cabinet need to be thinking of at a national level. And I know that I'm assured that they're working on it. The question is going to be how quickly, how big, and where will the money go? And so what I am urging the federal government to do is to make it very quickly, on the side of being larger than they might think, and rely on states. And that's why, again, I cannot emphasize enough, Senator Reid, Senator Whitehouse, Congressman Langevin, Congressman Cicilline, I'm talking to them every single day. They're asking the right questions. Governor, what do you need? But that's also the message we're delivering. I'm delivering to the Treasury Secretary, I'm delivering to the President and the Vice President. We need to replenish our unemployment insurance fund. We need to get aid to our hospitals immediately. We need to help the state with our own liquidity. And then beyond that, I'm very worried about evictions. We're telling everybody to stay home. Well, then people need to be able to live in a home. So I'm sharing that with you not because I have an answer today, but to give you a flavor for the things we're working on and the things that I hope to be able to announce in the coming days or a week. But that kind of a economic response that you're calling for, and I think is correct, must come from the federal government.
I believe Warwick has suspended their deadlines for taxes and utilities. Do you encourage other cities and towns to do that if they can?
If they can. If they can, if they can. Them, it's a balance, it is a balance. It depends on how well financed they are as cities and towns. It's in nobody's interest for any city to run out of money. So, this is all about balance, judgment, taking it a day at a time, doing the best you can with what you know at the given moment.
Governor, what about extending testing and using commercial labs?
We're working on that. We are absolutely working on that. And again, here in Rhode Island, we're doing better than many other states. Right now, actually, the rate limiting factor is the swabs. So our hospitals are just about ready to begin doing the testing. The commercial labs are getting there. But most of my phone calls today have been about swabs.
How does that work out? What's the difference between swab numbers and testing kits?
So I'll let the doctor answer in some detail, but it's like, strep throat or something. They have to collect the bodily fluid with a swab, and then the test has to be run. So there's a lot of parts of this, right? There's the collection at the point of patient, then there's the safe transmission of that to the lab. In the lab, there's the hardware, the machine, as well as the reagents. So it's kind of like the printer and the toner cartridge. Unless you think that was terrible.
Raimondo.
So that's, I'm trying to dumb it down to my level, and I figure that would be good for.
So we have an issue with swabs.
Correct. I mean, to be clear, we are really taking this a day at a time. That's our big issue at the moment.
And it's not just us. This is
And it isn't just us. Dr. Alexander Scott is exactly right. I mean, you're seeing this everywhere. You know, we've done, the good news is, we've worked very hard to get more testing sites and labs up and running. Good news, very good news. But in order to be able to collect the samples from the patients, we need the swabs.
Doctor, would you like to see more testing? How much more testing would you like to see? And how do you get there?
We get there by getting the supplies that are needed. The governor mentioning that this is a national issue is why she has been on the phone with the federal government endlessly, continually. We're not the only state that's saying this. And once we can have the supplies that we needed, we have the people that are ready, we have the sites that are set up, then we can move to the expansion for people who want to get the test and have symptoms. But because of that limitation that every state is experiencing, all of the places that have been ordered are on back order, we have to focus and streamline our test for those highest priority, higher risk folks, the hospitalized, those from congregate settings, and healthcare workers.
What would you like to see in terms of testing?
We want to be able to test those who we have the capacity to test. We have sites that are up and ready to go. We have, the commercial labs and the hospital labs who are ready. If there are people that have symptoms, that would be an ideal situation. But because of the inadequate preparation and because of what every state is experiencing in terms of the back order with swabs, we have to focus on those that are that highest risk right now. So I want to have everyone understand the importance of that adjustment, and to know that if you have symptoms and you can recover at home, whether or not you get a test does not change the treatment or the outcome. People can still recover at home, rest, get fluids, and get better. That's a critical point, because I know it's not being said the same way at the federal level, and we want to make sure all Rhode Islanders understand where we are and how you can continue to get better yourself.
Appreciating that we may yet be in the early stages of all of this, how will we know when we have flattened the curve to the extent that we can ease up on some of these restrictions?
That's a modeling process that we are going through and are continuing to study and assess. As we get additional data, we'll be able to understand that. So it's early to tell when that process will be here, but we are fully engaged in our planning and surge assessment.
Doctor, do you have any guidance for pharmacies, especially in-person contact? Do the cannabis stores fit in the category of pharmacies in this discussion right now? How does that move forward?
We're going to continue to work with all of our partners. We definitely still want to emphasize the importance of avoiding crowds. We want to be able to support pharmacies in having more electronic and phone service so that something can be ordered and then picked up quickly, access drive-thrus where it's available. We are definitely continuing the message that if you are sick, you should not be leaving the home and going out. Someone else can do that for you. The treatment for these viruses are rest and drinking fluids for the most part. So we want to help protect pharmacists who are part of our healthcare workforce, critical members of our healthcare workforce community. So please make sure you're not going to pharmacies with symptoms of illness.
And on the cannabis stores, are they going to stay open? Are they considered part of pharmaceutical?
We're still assessing that. Thank you.
One person still in the hospital. Deadline.
Sorry, what was
So we still, one person still in the hospital, one case?
Yes.
Governor, any
Brian, Amanda, and then we're gonna have to come back.
That's
Governor, any
helpful.
thoughts on extending the state tax filing deadline and being able to send some of those workers home, or is that work still
We're,
ongoing?
not yet. It seems like the federal government may be moving at the federal level, so I'm going to wait a bit on that decision. Who is
Amanda?
next?
Oh, sure. Just getting back to the testing thing. Now, 23 doesn't sound terrible compared with other states. However, when you're saying that we're not really testing everyone, doesn't it mean that the number probably is actually higher?
Could be. So to answer Steve's question, the reason we want to be able to test everyone is we'll have more accurate data, we'll have a better model, we'll be able to see where this is going. But it's certainly true in every state, everywhere, like the testing issues we're facing are everywhere, that yes, probably you're right. There are folks out there who we don't know.
Thank you, Governor. We'll be back tomorrow.
Oh, what about the election?
Oh, yeah. Are you going to?
And we are coming out of a news conference at the Department of Administration in Providence with Governor Raimondo and the health director. And to sum up some of the things that you just heard, a couple of key highlights. There are 2 new cases in Rhode Island. As you heard the governor say, a man in his 50s and a woman in her 40s. The man had recently traveled to countries including Germany and the UK, and the woman's source of infection is still under investigation. We are told that both of them are recovering at home. Meanwhile, you also heard Rhode Island Foundation and the United Way. They have launched a COVID-19 recovery fund. They say they've already raised $1.5 million from several local businesses who've taken the lead on this, and the governor illustrated some of those businesses. You'll find that on our website. Also, the SBA, that's the Small Business Administration, they did approve the disaster declaration for Rhode Island, which the governor had requested, so small businesses can apply for loans for up to $2 million. Also, another key highlight, Microsoft is offering Office 365 free to all Rhode Island businesses for 6 months. The governor, of course, encouraging as many businesses as possible to allow their employees to work from home. Also, this is important for parents who may be watching right now. The governor says an announcement on all public schools and remote learning will likely come during her news briefing tomorrow. Also, we can tell you dentists, this has been a question we've been hearing. Should dentists continue to have appointments? They're being asked to suspend all non-essential appointments for the next 21 days. And the Department of Health also says guidance on avoiding crowds does apply to funerals and wakes as well. Governor and the health director indicated that's going to be difficult. Of course, if this happens in the next few weeks, they do say that people who are older or have pre-existing conditions, you are reminded that you should stay home. And right now on our website and the WPRI 12 News app, we have minute-by-minute updates on any event cancellations, school closings, and more. Thank you so much for joining us for this live update, and join us tonight live at 5 for the latest coverage right here on WPRI 12.
Stay with Eyewitness News for the latest on this breaking story.